another of our International Impact Safety webinars. We're excited to have you all here with us this morning, and we look forward to a lot of great discussion, question and answers. Obviously, we're going to be discussing the COVID-19 pandemic, which 4 months in, who knew that there was going to be a resurgence, and even in the South, where we had hoped that heat would be something that would wipe it out. We're finding out now that this pandemic seems to be smarter than we are, and a lot going on. As always, it seems that there's way more confusion and uncertainty than there are answers regarding this for everyone. We're all in this together. Seems to be not only in North America, but around the world. So our topic, or what we're really looking for today, is how we keep iron workers on the job and safe. We've got quite a few guest speakers here with us this morning. We're going to be doing a few things a little bit different. There's going to be some polling questions that happen as we go through. We ask that you would answer them. They're fairly easy to follow along with. The first one is actually up now. We're simply asking what your current role is. If you can go ahead and vote on that, that would be great. We've got multiple speakers. We really want this morning to be very much a town hall type of discussion. We're really looking for your questions, your thoughts, even answers, even things you may disagree on. Again, because there's so much confusion out there across America and Canada with COVID-19, different rules that pertain different states that border each other, even cities within states that have different rules. So again, we're really trying to coalesce here and gather up as much information as we can and share that. We're not going to be discussing things such as compensability or work comp rules and getting into each state's and city's separate rules, because we just could never get all those answered. But we do definitely ask for your participation. When you go to the tab on the bottom, you'll see a question and answer button. I would ask that as you have questions, you use that button. There's also a chat button. We're not going to be monitoring the chat. If some of you would like to use that to have discussion as we go along, feel free to use that. But if you have something that you want me to ask of our panel, please do that through the question and answer tab. There's going to be more of these coming up in the future, so just be aware of those. Looks like we've got pretty good presentation. You can see the poll results should be live on your screen. And again, this is just information that we're going to have to use to better serve in calls to come, and just take this information and try to gather things up. So with that, our first guest speaker this morning is going to be General President of the Iron Workers, Eric Dean. I'm going to get him turned on here when he joins us. I know Eric has a few things he'd like to share. So,
good morning.
Good morning, Eric. Thank you for being here with us. And go ahead,
well,
please.
Pete, from the Impact Board of Trustees, the genesis of these safety talks, I can't thank you enough for continuing to host. And Steve and the safety department for their efforts in changing the variety of topics. This topic is near and dear to all of our hearts. As the leader of an organization, I rely on the local unions and its leadership, and the employers and its leadership, to provide a safe work site for our members. And that's navigating the traditional hazards that we have. In addition, we have this newest health effect that never really prepared for. We've always had good habits and tried to tell our members, to make sure they clean up and keep a neat work site, but we've never had a virus in this manner affect our workflow. So there's a couple questions. First of all, the International asked provincials, provinces, and states to deem construction workers essential. Oh boy, when you ask for that, then you open the door to, now I got to make sure the members are being protected in a uniform manner, consistent across the board, making sure all the employers are using the same protocols, making sure all our members are following the same protocols and giving the same advice to the leadership. So you guys taking the time, if you've had the experience and already been returned back to work, I know some of the greatest areas affected were maybe New York City and Boston and the province of Quebec, where they had complete shutdowns. And then Pennsylvania had a pretty big shutdown. Other places never experienced a shutdown. So it's like, how do you navigate this on the fly? How do you ensure you got the protocols? I can tell you, as a building owner here, we've taken steps to ensure our employees at headquarters, when they do return to work and the stay-at-home orders are lifted, that we have the confidence that they're going to come to work and not be sick. The ironworkers need that same confidence. And a lot of times the ironworker leadership in the local unions need guidance from us. So I'm looking forward to the speakers today. I don't have, we've provided as much guidance pretty much that's from the CDC and the building trades so that we're consistent in our approach, but I'd rather listen to the subject matter experts from the safety department. I wanted to thank the contractors and their leadership for making our members safe. I'd like to thank our ironworkers for making our leaders in local unions make sure that there's safe, consistent method. And if there's something more the International can do, please do not hesitate to ask. Warms my heart to see 254 people on this call that care about, whether you're an employer, you care about your employees, whether you're a union leader, you care about our members. And with that, we have a covenant to make sure everyone goes home safe every day. I ask for you to pray. We've lost 9 members this year. Pray for their families. Pray for the people who are living that have to live with the aftermath of job site fatalities. But this thing is unseen. You can't take the same steps as like tying off and doing the things that you know are tried and true to keep people safe. This one here takes a collective effort, and I appreciate everyone putting that together. I'll get out of your hair and just thank you all for what you do on a daily basis.
All right, Eric, thank you so much for being here this morning. And I would second that. Boy, I know everyone has across the world different ideas of religion and things of that nature, but sometimes prayer and just caring for and loving the people around us is a big deal. As Eric mentioned, there's been 9 fatalities and multiple ones dealing with COVID. Hundreds, sadly, thousands outside of our industry. So do all we can to just act as one and care for everybody around us and take care of what we can. So with that, we're going to introduce Steve Rank. He is the safety director for the Ironworkers. And Steve, thanks for being here with us this morning. And there you are. It's good to see you.
Great. Thank you, Pete, and welcome everyone. The slide you have on here is we wanted to establish a dedicated phone number and a dedicated email so that we could get direct contact and more prompt contact from local unions and our contractors throughout North America. When this pandemic hit, we could not hesitate to respond to people going through the International's headquarters in Washington or through the Impact office. So we have a new 800 number here that you see on your screen that will leave a message for Jeff in Canada, for Wayne, for me, or the general number that Christy Rose has at the main office. So feel free to call us anytime you need any kind of help, question, or assistance. We also have a dedicated safety email address that you see on the screen here that better helps us to serve our members and our contractors. Next slide, please. One of the first things that we put out was the development of a report form. This is a report form so that we can have a better idea on where our members are getting affected around the United States, whether they're an apprentice, whether they're a journeyman, whether they're a retiree. We want to know if they're getting infected with this COVID-19 and what we can do to help. So on your screen there, you'll see a little form. It has a little electronic buttons at the bottom where you can type in on the screen and push send, and it comes right back to the safety email address that you saw on the previous slide. So we continue to encourage the local unions and our contractors to please send these to us so we can get more accurate numbers. It's been very helpful since the development of this, and I appreciate everyone's help in the safety department to get this up and going. Next slide, please. So I wanted to introduce Wayne Cressup. Wayne is a district safety representative for the Safety and Health Department. And Wayne put together this slide showing the concentration of COVID cases around the country. So Wayne, take it away.
Hey, thank you, Steve. Good morning, everyone. Hope everyone is doing well and your summer is off to a good start so far, in spite of the circumstances that we're dealing with coronavirus. As Steve mentioned, the report form that we showed on the previous slide, we've taken that information and we've tried to gear it to a map of North America with the US and Canada. And what you'll notice on the map is we've put red. We just simply went with a red, yellow, green scenario here. Red button or red tab on here indicates a positive test or a positive test in self-quarantine. A green button was suspected or recovered, or a positive test, self-quarantine and recovered. So just try to keep it simple. Those are green. And then yellow was we're still awaiting information at this point, whether they tested, they were still awaiting their test results. The other elements, unfortunately, we also lost 5 members that are marked with a black ribbon. So you can kind of see what is listed on the slide here. To date, we have 69 reported cases, 64 cases in the United States and 5 cases in Canada of what have come into us that have been shared. And we encourage all of our members and contractors to continue to send this information into us so we can update our map accordingly. We can hopefully get to see those that may have contracted the virus coming up and showing that not only have they contracted it, but also have recovered. Because we like to turn all those red buttons on there to the green, showing that we're moving forward. Next slide, please.
Say before we
as we're getting ready to advance to the next slide, just take a look. Hopefully you'll notice on this slide the location of all of where our members are. And if you could advance to the next slide, please. Go ahead, Pete.
Say, we had a couple of questions pop in. The first one is, where are the forms located? I think
while we're waiting for that, if you can back up one slide, please. So the forms are located, we have them on the international site. We've been sending those forms out weekly as part of a weekly report that Christy sends out from the safety department that carries the summary of the information of what we have at that point in time. And if anyone is still looking for those, just shoot us an email at safety@iwintl.org, and we will make sure that we get that form out to you. We've also sent it out through Impact, and it has been distributed through the
It looks like we've lost Wayne.
We have.
Emails and on the Impact website as well. If you take a look at Corona 3.
Steve, can you take over for Wayne here until he gets his audio figured out?
Yes, I will.
Is this any better?
No.
No.
So, Steve, we've got another question that's come in. Do we need to update the information if members recover?
Yes.
Yes. Okay. So you're asking people, and this comes from a business manager in Arizona, Jason Sangster. You do want updated information as members recover.
Yes, that's part of our report form is we want to know that they're back to work, they've recovered, they haven't gotten worse. So yes, we would appreciate that information.
Okay, all right. So maybe can you move on for Wayne until we get him figured out on what to do for,
Sure, next slide. As Wayne was describing, this is the concentration that we have in Canada. And Jeff, maybe you want to elaborate a little bit on this particular slide for Canada. Jeff Norris.
and I will get Jeff turned on here so he can join us. Morning, Jeff. Thanks for being with us.
Good morning, everybody. All right, how's my audio, Pete?
You sound great.
Okay. Yeah, so the slide that you're seeing there, good morning to everybody, is a map of Canada. And we have roughly just about 38 million people across the country. It's a very large landmass. It's over 9 million square kilometers, which equates to about 3,500,000 square miles. And within that, if we take the population and we spread it out, that's only 11 people per square mile or per kilometer, 4 people per kilometer. So it's important to note that approximately 81% of our people in Canada actually live in an urban area. So as Wayne was explaining in the United States, if you look at our country of Canada, we have a similar pattern that's going on. Next slide, please. So in this slide, you'll see the total cases of COVID-19 in Canada and this was taken a week ago, June 30th, 104,000. And these are confirmed and probable cases. So in this map, you'll see the darker blue areas. As Mr. Dean mentioned, Quebec was completely shut down, including all construction and maintenance activities, with the exception of essential utilities. And you'll see that they've had a high case count. And to the left, that's the province of Ontario. Again, a large population of people equates to more cases. Next slide, please. So at this point, I don't know if Wayne's back on or not. I'll probably just turn this over to Steve to comment on what's changed and what some of the misconceptions are associated with COVID-19.
Thanks, Jeff. And I apologize for not introducing Jeff, but Jeff is the Canadian Safety Coordinator that handles all the safety and health issues within all the provinces across Canada, and he does a really good job. On this slide that you see here, the changes and misconceptions, there's been a lot of changes since our previous webinar featuring Dr. John Howard, the director of NIOSH. What has changed is what we've learned is this transmission of COVID is most commonly through the respiratory droplets through close interactions. And that's why the emphasis of wearing masks so that you don't infect someone else is very, very important. We've also learned that the biggest risk factor is age and also pre-existing conditions. If you have a lung condition or a heart condition, a pre-existing any type of condition, I think even diabetes, that this type of virus will seek out and attack those places, particularly the lung area, as a weakness in your body. So they have targeted that something new. Also, previously, 2.5 months ago, 3 months ago, we thought that surface contamination was going to be the primary method of transmission. But what they're finding out is the surface contamination, the short lifespan it's much shorter on a surface than it is in the air. So the preliminary feeling that we have to wipe everything down several times a day, it's a great practice. It's a good, safe practice. But what they're finding out is these surfaces are not the primary method of transmission, but airborne droplets is. There are some new symptoms that you can find on the CDC website, the NIOSH website, symptoms that that you will have as you get this, much like the flu. And so these are things that they're now starting to identify. So these are just some of the changes or misconceptions that that have changed in the last 3 months since our first webinar. Next slide, please. And I'm not sure if Wayne is back on the line, but I'll take this last one here. So just how big is this this
Steve,
virus?
can you hear me?
Yeah, Wayne.
Yeah, I'm trying to get back on. My apologies, everyone. Everything was working fine going through the dry runs, and then today it just didn't want to cooperate.
Wayne, if you would, explain to them just how big this is using this simple graph.
Sure. So what this graph indicates is just how small the droplet containing the virus. It can be as small as 1 micron, which is 1/25,000th of an inch or 1/1,000,000th of a meter. To give you a little bit of an idea of what that is, a human hair by comparison is 60 to 120 microns. Unfortunately, Steve and I don't have a whole lot of that to compare with on the tops of our heads here, but you can kind of get an indication that 1 micron is a very, very small. Now, an oxygen molecule is even smaller than that 1 micron. And we'll talk more about that when we get into the respiratory protection as far as how that incorporates into a respirator or a face mask. But this hopefully gives you a little bit more of an idea of exactly how small we're talking about. Microscopic. Next slide, please. So some additional facts that we had, we talked about coronavirus is a virus, not a bacteria. The virus that causes COVID-19 is in a family of viruses called Coronaviridae. Antibiotics don't work against viruses. This is why there's been a big push for vaccines, trying to come up with something that will help prevent the spread. And also, we've also had more things when we talk about contact tracing and herd immunity as a way to try to help build up the population to have more of a resistance to this virus. Thermal scanners cannot detect COVID-19. The thermal scanners simply indicate temperature as far as an elevation in temperature that indicates that somebody may have a fever, but it does not indicate whether or not they have COVID-19. So additional steps need to be taken to actually determine whether or not someone would have coronavirus. And then the prolonged use of medical masks or a surgical mask when properly worn does not cause carbon dioxide intoxication or oxygen deficiency. It's, again, that carbon dioxide molecule and that oxygen molecule pass through those respirators or through those face masks very easily. What we're trying to catch are the droplets containing the virus, that for being spread. Next slide, please. So we had General President Dean mentioned this morning about some of the issues that we had dealing with essential and non-essential construction, and where we had a lot of projects that were taking on a lot of different infrastructure or providing service to the power and other industries that were deemed essential, and a lot of companies didn't miss a beat, and we had a lot of members that were working throughout the United States and Canada. However, in other areas where we had high concentrations of COVID cases, we unfortunately had to step back, and there was more businesses that were shut down in the interim. As we're trying to get things moving again, unfortunately, we've had a recent spike here from the July 4th holiday and from just before the holiday. So it's going to continue to see where we go and assess things based on where those numbers are. We're starting to see more communities incorporating face coverings as a requirement now in a lot of different counties around the United States. Next slide, please. So we do have a poll question. As we've been developing things, as Steve mentioned, everything has been changing constantly, and we've put together a Dropbox kit. So the question is, are you aware that the Ironworker Safety Department has developed a Dropbox folder containing COVID-19 resources and sample programs? I'll give you a couple of seconds to click on the poll question. Okay, and that kit contains information that has sample programs, it has sample posters, a variety of other materials, guidelines, and links and useful resources, checklists, toolbox socks, a variety of materials that are in that kit. And so when we make this PowerPoint presentation available, we actually have included the link in this PowerPoint. So for those of you who are unaware of that kit as being available, hopefully you'll take a time and look at this slide, take a link to the kit and look it up. We put a lot of different material in there on videos, guidelines on face coverings. There's a lot of good information in there that I think will be helpful as we work through this. Next slide, please. At this point, I'm going to turn it over to Jeff Norris, who has a COVID protocol to talk about our hierarchy of controls. Jeff, you're on.
Sorry, can you hear me now?
We hear you now, Jeff, yes.
Okay, I apologize. So the graphic on the left hand of your screen is what we call the hierarchy of controls. This inverted triangle is used to control exposures to occupational hazards and is the fundamental method of protecting workers. Safety professionals would definitely be aware of this hierarchy of controls model. Some of you on the line, maybe it's the first time. I'll just take a brief moment to explain how this works. Traditionally, a hierarchy of control has been used as a means of determining how to implement feasible and effective control solutions. The idea behind the hierarchy is that the control methods at the top of the graphic are potentially more effective than those that are at the bottom. So following this hierarchy normally leads to implementation of inherently safer management systems where the risk of illness or injury has been substantially reduced. So at the top, elimination and substitution, while most effective at reducing hazards, also tends to be the most difficult to implement in an existing process. If that process is still at the design or development stage, the hazards, control of those hazards may be inexpensive and simple to implement. For existing processes, major changes in equipment and procedures may be required to eliminate or substitute for that hazard. Engineering controls are in the middle of that triangle are favored over administrative or personal protective equipment for controlling existing worker exposures in the workplace because they are designed to remove the hazard at the source before it comes in contact with the worker. Well-designed engineering controls can be highly effective in protecting workers and will typically be independent of worker interactions to provide a high level of protection. But the initial cost of engineering controls can be higher than the cost of administrative controls or even PPE over the long term. In terms of the lower end of that triangle, the administrative controls and PPE are frequently used in our industry with existing processes where hazards are not particularly well controlled. And this is commonly the case with biological hazards in a construction, maintenance, or in manufacturing environment. So administrative controls and PPE programs may be relatively inexpensive to establish, but over a long term can be very costly to sustain. And Wayne and Steve are going to mention the problems that we're seeing with supply chain a little later. Next slide, please. So when we look at the COVID-19 protocols and using the hierarchy of control, elimination could include something like screening of workers. So asking workers to self-identify symptoms such as fever, coughing, shortness of breath, no touch or no contact thermometers can be used. Infected workers should be removed from the project or the shop, and the work area should be disinfected. And when there is a positive COVID case, contract tracing should be done so that other employees can be notified. Administrative controls examples are distancing. We've all heard this in the media. We're likely practicing these in our daily lives, creating at least that 2 meters or 6 feet of separation between people. That can be done by staging or staggering crews, modified work schedules to stagger the work, alternating work days, extra shifts, reducing the total number of employees at the job site at any given time. Identifying choke points to eliminate areas where workers are within that 6 feet, which includes things like hoists elevators, break areas, and even transportation. Administrative controls can include also cleaning. And as Steve mentioned, with some of the misconceptions early on with COVID a few months ago, it was thought that surfaces could actually be infected with the virus for some time. What we're hearing now is that maybe not necessarily the case, but still, cleaning and disinfection of high-touch surfaces such as doorknobs, tools, handrails, portable washrooms, and ensuring that those disinfectants are available and replenished throughout the job site or the shop. Hand washing can also be a form of administrative control. We're providing running water with soap for frequent hand washing, providing alcohol-based hand sanitizers with greater than 60% ethanol or 70% propanol as a backup, only if providing running water is impossible. Encouraging workers to leave their workstations to wash their hands before going to the washroom, before eating, after coughing, sneezing, blowing their nose. These are all behaviors that employers have to implement and that our workers, our iron workers, have to embrace. And lastly, as I mentioned, PPE, and where close work is unavoidable, providing NIOSH approved respirators, the complete respiratory program must be used. So cloth face masks are not respirators. Wayne's going to explain the difference a little later. Acceptable respirators for filtering face pieces or elastometric negative or positive pressure half mask, full face respirators. We've heard about N95s. We've got N100s, P100 filters. These are all respirators. And if these respirators are used, that would trigger the OSHA 1910.134 respiratory protection standard in the United States and the CSA Z94-418 standard in Canada, which is the selection, use, and care of respirators. So with that, our next poll question, if we could have the next slide, thank you, is do you have a written COVID-19 program as part of your safety and health management system? So if you could bring up the poll, we'll take a few seconds, say yes, no.
Jeff, while people are voting on that, we have 3 questions that popped in. And so between yourself, Wayne, and Steve, I'm sure we can get these answered. The first one I can probably answer, and you guys can weigh in if you want, but Jim Edwards has asked, how can a signatory contractor recover the cost impacts incurred due to this pandemic? Jim, if you have an answer for that, I'd love to hear it, because I would say at this point in time, there is no way to recover the costs due to the pandemic. I know there's the PPP loan that was offered to contractors, and many construction is the #3 user of those. But other than that, there is no way to recover these costs. It's the world we live in, and it's where things are at. I don't know if anybody else wants to add to that, but
Pete?
Yeah, go ahead, Steve.
I just had one comment, if I could, please.
Yes.
Some of the feedback that I got from contractors around the country was they signed contracts last September, October, and halfway through the middle of their projects, they were being asked to do additional things. And these additional things required extra PPE, extra money, extra cost that the question was asked. So I guess a contractor has to look like that as a change order. And I hope that our contractors can somehow successfully negotiate that this was an unforeseen issue. It wasn't part of our contract to do all this additional safety protocols. So I'm hoping that there is some flexibility with some of the contracts and the contractors, and I hope that they have room for to receive some additional costs. Pete, have you heard of any of this being reimbursed?
No.
It wasn't in the contract?
Nothing. Nope.
Okay. I guess a lot of it goes to the contract document itself. Many contracts specify that if there's any unforeseen safety or health issue, that the owner or the general contractor can dictate what the policy is. And so, unfortunately, we probably fall into that category. Pete, would you agree?
Yes. Christy, if you're there, I don't know why, but I've lost my screen that shows everyone. But let's get on to the questions. Any recommendations on record keeping in regards to COVID-19?
That's a Wayne Cressup question. Wayne?
Thanks, Pete. Yeah, I'll do what I can to try to answer that. Again, because this has been ongoing and it's been very confusing in maintaining this, OSHA originally came out and indicated that, Fed OSHA came out and indicated that this is not related to here we go. All right. Federal OSHA came out and said that, in the original record keeping standard, the cold and common flu are not recordable under the OSHA record keeping regs. However, OSHA came out with, when coronavirus started to hit the United States, Federal OSHA came out and said that this is considered as recordable. And a lot of contractors then pushed back and said, well, wait a second, how do we know? Because the issue of work relatedness. So OSHA has gone back and revised a lot of their guidelines that still indicate that yes, it is recordable if it can be shown that the individual contracted this while at work, then it would be considered as work related. The challenge is because of the long latent period where you're looking at somebody having an exposure within a few days and they don't show symptoms for up to 14 days, it makes it very challenging to be able to determine where that person contracted the virus and whether or not it was actually work related. So I've heard of some companies that maybe not necessarily keeping that on their OSHA logs. And unfortunately in the construction industry, this is what is so challenging, because the construction industry, if we're keeping these on our OSHA logs, this is going to calculate against our incident rates and could punish us when we're trying to bid future work. Whereas in some of the other industries, it maybe isn't that big of a deal because those rates aren't used as a measuring tool or a measuring stick against us for our safety history. But unfortunately right now, that is the determination. I actually have some information that is in here, and I will share with everyone on those links on the OSHA site with the record keeping, the current record keeping memorandum that came out back in May on how OSHA is going to be looking at this. Hope that answers the question.
And if I could provide a comment, Pete, regarding Canada, each provincial
Go ahead, Jeff, we hear you.
Oh, there we go. So each provincial jurisdiction and territorial jurisdiction has their own safety and health legislation and their workers' compensation system. So in most, just to generally provide an answer to that, it would depend on the jurisdiction in which the illness was to be reported, on how that would be reported. And what I can do is I will also circle back with Wayne with some resources to put onto the Dropbox for folks in Canada, contractors and members.
All right. Quick question here. Are the questions we submitted to get on the webinar going to be addressed, or what are we going to do with that information? Wayne, do you want to take that? Steve, go ahead.
Pete, if you would like to read one of the questions really briefly, we'll try to answer one of the 3 or 4 that were submitted.
Sure. Yeah. No, I asked if what's going to be done with the information we're gathering from the polls. Someone wants to know that.
Oh, okay. Yes, that will be posted on our websites, or if you email us, we will certainly send you the results of the polling.
All right. Another question, can the ironworkers set up a system or program where member contractors can access combined buying power for PPEs that they may not have good access to otherwise?
The answer is yes, and we have a slide later on. That's a really good question, and we have a slide in the deck in just a few minutes that will address our relationship with the 3M Corporation nationwide. So I'd like to defer answering that till we get to that slide in just a few minutes, Pete.
Okay. One last quick question. Somebody asked, the 4th of July was one day. Do we have any information as far as the protests on what the spikes in COVID-19 were during that? I don't know if that's something we want to address now, but maybe you do. But
I don't have any data from the 4th of July, Pete.
Yep.
That would be relevant to that question.
All right, let's move on from that one then. So that's all we have at this point in time for questions. If we want to get back to our slides.
Good. So, Pete, I would like to introduce our special guest speaker. We're really pleased to have John Johnson with us today. John is the Vice President, Director of Corporate Environmental Safety and Health for Black & Veatch. And John has been very, very proactive in dealing with COVID-19, and he's also very active in the whole safety and health industry. John serves as the chairman of the ANSI A10 Construction and Demolition Standards Committee. And so we're really pleased that John has taken time today to share some of his thoughts on what they're doing to get their arms around COVID-19, and also some very proactive things that John's going to announce today during his presentation. So please welcome John Johnson.
Thank you, Steve, and thanks for everybody for giving me the opportunity. I'm here primarily not as a representative of Black & Veatch. My main message is coming from ANSI ASSP A10 committee, and that committee, if you're unaware, deals directly with the construction and demolition operations. It's a consensus standard making committee that has roughly 100 members. But if you look at all of the other support in the standard development process, there's several hundred members, hundreds and hundreds of members that participate in this process. And I'm fortunate and privileged to serve as the chairman of ANSI A10. And Mr. Rank supports me as vice chair. So we have a very strong relationship, and we talk frequently about safety and health matters that impact us all. But again, thank you very much. I wanted to share a few things about what we're trying to accomplish with ANSI. This will be the first time in recent history that we will hold one of our biannual meetings virtually. So on July 21st, we will hold our virtual meeting. We typically do those in DC, where we have anywhere from 100 to 150 people in the audience, and we report out. We talk about new standards and new standard development. So this will be an interesting meeting, but we look forward to it because we have some very important business to undertake. We'll have 3 proposals for new standards. The first one deals directly with contractor and supplier pre-qualification processes. An individual will get up who is supporting that effort and give his case to the committee, and the committee will decide if we want to pursue that as a standard. The second one deals with cold stress. In our last meeting, we did vote to approve a heat stress standard, or develop a heat stress standard. We wanted to keep heat stress and cold stress separated. So there'll be a proposal to develop a cold stress standard as well. And last but not least, the one that's most important right now is we do have a proposal that I fully stand behind and support on dealing with a standard for pandemic and communicable diseases in the construction and demolition environment. I think we'll tinker around with the title, because if we have a standard that deals with pandemics, we're probably way too late. Once it hits a pandemic, then the ball is rolling. And we've learned a lot with COVID-19 that as soon as we start to hear about things, we ought to be doing things differently and at least getting some pre-planning done. And the focus of this particular standard is to provide guidance to employers primarily. It could be contractors, or excuse me, it could be clients, it could be building trades, whoever, but provide some generalized guidance on what we should be doing in preparation for viruses or other diseases that may impact the way we live. Now, if we look at how the construction industry has handled COVID-19, and this is just my personal opinion based off a lot of interaction with large companies, our competitors and peers in the industry, several of our major clients from an international perspective, is the construction industry has done a phenomenal job being critical and being determined to be critical, has done a really good job of trying to impact in a positive way the spread of COVID-19 or dampening that or minimizing that. And I think that's because of the methodology and the mindset of construction organizations is to jump out in front of these things as best we can and try to minimize the impacts. You know, if you compare that to the medical community, which we heard a lot about, and how prepared they were from a PPE perspective, process and procedure, there was a lot of learning across the board. And I'm not being critical of the medical community, nor the meatpacking industry, where that has been greatly impacted. You know, there's a lot of things that need to be done inside the four walls of different types of manufacturers, but meatpacking is a prime example of probably a delayed response that has caused a lot of problems with the individuals that do the work inside those facilities, as well as the economics of dealing with the outcomes of having minimal product coming out the door due to the impacts of COVID-19. Where construction operations, you know, haven't been perfect, but generally speaking, construction operations have been at the forefront of utilizing some of the common controls that are in place. And we're proud of that, and we should be proud of that. But I think this standard, if we do get this approved, will be a step in the right direction to help us with future issues, as well as help us get through the COVID-19 situation that is far from over. It's as bad as it's been, at least in the United States. And we're not even close to being through this mess yet. So everybody's attention to detail would be appreciated. But the one thing that I guess my ask of this audience today is we need your support. ANCA 10 needs your support. We need your expertise. We need your participation in the development of this standard. If we do get an approval on our proposal, my expectation and my request when that chairperson is nominated is to expedite this standard and to get this through the process as quickly as possible. We will follow all the protocols that ANSI puts in place on the development of a standard, but we want to move this. We want this to be a fast process. We want to develop a standard quicker than anyone on record as far as ANSI 10 is considered, because the industry needs it. And we want to continue to be leaders and out in the forefront on how we combat COVID-19. Now, I don't have a whole lot of time for remarks, and I don't want to take up all the information that will be shared later. But I want to offer just a few thoughts on what I think and what we've experienced at Black & Veatch and a group of other large employers that are global employers, you know, and most of them, 5-6 times the size of Black & Veatch. But, you know, we do meet every couple of weeks and we share and benchmark on what's working, what's not working, other concerns. But one of the tactics that I think is extremely important is crew size. We try to keep our crews to a maximum size of 10, and then we segregate those crews as much as possible. That way, if a crew member does become ill or does get exposed to COVID-19 outside the workplace and they bring it inside the workplace, then that's your first tactic to control the spread. And that's the critical message that we have to all of our crew members, our supervisors, and our site management teams is keeping crews to a minimum size, stop swapping crews and taking people and rotating them out as crews as much as possible so that you can try to contain it at the least amount of exposure as possible. And the segregation of crews, you know, when they're eating, when they're doing certain tasks, things of that nature, is critical. And that is one of probably the best control that we have in place. And as was mentioned with Mr. Norris before, that was one of the controls. It's kind of lower on the list, but considering our options, that's probably the best thing that we can do. Temperature checks, health questionnaires, masks, face coverings, all those things are standard. They should be standard. There's not a silver bullet to any of this, but putting people through the paces day in, day out on what their exposures may have been either in the workplace or outside the workplace, the best thing that we can know is what's going on. So if there is a potential exposure, there is a concern, there is an issue, that we can get it addressed. And if we need to put people in quarantine or segregate folks more or put people in monitoring protocols, then we can definitely do so. And that also brings up a huge question and a critical issue is if you're not providing relief or support to your craftsmen and women from a reporting process standpoint, that's something that should be considered. I can speak for Black & Veatch is we do have a policy. We have a leave policy that we updated at the very incipient stages of COVID-19 because we were concerned that if people aren't reporting, that they're going to come to work and it's going to cascade throughout the project and then everybody's out of a job. So what we do, and we would recommend other folks that have the means to do so, is when people report an issue, report an illness, they report an exposure or a potential exposure to COVID-19, we pay them 80 hours, no questions asked. And that way they would report it. They know that they're going to get a paycheck for at least 2 weeks as they're dealing with this issue, and hopefully they can recover. And we're minimizing the impact to our job. Because with most employers that are represented on this call, that is our lifeblood. And the construction workforce is the front line. And without the workers, then we're all done. So their protection and their viability when they're dealing with a COVID issue is extremely important. Now, how feasible can that be maintained if this thing continues to blow up and more people get exposed? I don't know. We deal with it on a day-to-day basis at Black & Veatch. But we believe that having that relief for our craftsmen and women has been extremely important. You know, we've got, around 11,000 employees. And then when we deal with our construction projects with contractors, we probably have 20 to 25,000 people on our projects globally. And to date, we've had, I believe it was a count this morning, that we've had 18 confirmed cases and 4 presumptive cases out of all of those members. And we're pretty proud of what we've been able to do to control that. But that means that there's personal accountability and responsibility on everybody on behalf of that job, not just the employer and the site leaders and the management teams, but the craftsmen and women as well. And I'm pleased to report that we've had great cooperation across the board to help minimize the impacts to our jobs, because we haven't shut one of them down. We've had some slowdowns and we had some scale back, but everything's been kept going. We've been keeping people employed, and more importantly, we've been keeping people healthy in their work environments. So we would appreciate all of your support from an ANCA 10 perspective if we do get this proposal approved. And if there's any questions or any thoughts that you have that we can help advise from Black & Veatch's perspective, Steve and the rest of the panel, we're all ears. So I'll conclude my comments there.
Thank you, John. John, if you could just take a brief minute to explain to everyone the cross-section of the ANSI, how broad the membership really is, and how when they develop this standard, it's going to be everything from insurance carriers to contractors to labor people. Could you give a little bit of perspective on that?
Yeah, part of our procedures is we have different types of industry groups. So you have employers, you have employee representatives, you have academia, you have insurance people, you've got safety experts, you've got consultants, and they're all categorized into basically 4 categories. And to have balance, you can't have more than a third from each industry group or each category, so that we can't have the employers come in and roughshod a standard through at the behest of employee representatives. Or you can't have other special interests come in and try to roughshod a standard through. So we're equal and we're balanced, and we have to maintain that balance or we can't produce standards. And ANSI would give us a hard time if we weren't balanced. So we spend a lot of time to make sure we are balanced, but we have a broad representation, as I mentioned, with hundreds of people that participate in the standard making process, from the construction and demolition industries, insurance, owners, contractors, large and small, a lot of union representation from the buildings trades, which is fantastic. We have government organizations, NIOSH and OSHA and other types of state representatives that come in as well. So it's a very broad group of what we believe is the industry leaders and experts in safety and health and construction and demolition.
Thank you, John. Pete, could you ask if there's any questions for John?
So we have one here that I think John could give us an answer on, because it pertaining to kind of what a general contractor should do if there's been an outbreak in their field office. Or maybe you can tell us what Black & Veatch is doing there. How are you getting that information out, and what's kind of your policy been?
Yeah, if we have a case in a field office or an office or wherever, being open and honest that you've got a situation is critical. So, contact tracing is extremely important. There is a decision tree that we've developed based off CDC guidance. So we have 4 predominant categories. Somebody reports they have a confirmed COVID case. What do you do? They may have been exposed to somebody in their off-duty life. What do you do? Somebody has been exposed to, we have a lot of different variables, but whenever that's reported, our job as an employer is to make sure we do the contact tracing, and we inform everybody that may be in direct contact, which CDC says within 6 feet for 15 minutes. Black & Veatch, we say 6 feet for 10 minutes because that's what the original guidance was from the CDC, and we haven't changed it because we think that is representative of an exposure. And we also have a definition of what's called indirect contact, and then the process to follow. So if you've been in direct contact, you got to go on 14-day quarantine. Indirect contact, you'll be in self-observation for 14 days. And then expediting the testing as much as possible so that we can get results, so that people know. There's nothing worse than saying, no, I've been potentially exposed to somebody. I don't know if I'm sick or not. And if we can get that original person that is a suspected case tested quickly, and that's becoming more and more of a challenge now, then that provides relief for people. But yeah, I mean, as an employer, you have a responsibility to your employees, regardless of what level and where they sit in the organization, to say that you have a potential exposure, or you may have been exposed or potentially exposed, through the contact tracing process. It's laborious. It takes time, it takes effort, and you have to sit down and do it and talk to people. And we spend a lot of time doing that when we have suspected cases or confirmed cases that we have to go back to our job site. But you have to tell people, there's no secrets here with COVID-19, because we're talking about life and death. And people have got to make decisions on behalf of what they're going to do to go home to their families, or do they go home to their families, or how do they self-isolate? So yes, I think that the simple and most moral question or answer to that question is absolutely, you should be doing that, and you better be doing that.
All right, and that certainly makes sense. I hope everybody's doing that, being truthful and honest, and getting information out there is what is needed. Another question, I'm gonna tweak this one just a little bit, and I'll place this to you, John. What are you doing with the masks and gloves and things that are used on the job sites? How are those being disposed of? And in an overall question, they ask for the general public, because I'm sure now we're getting millions and millions of these masks used, rubber gloves, things used. What's the best, or what are you guys doing when they're being disposed of?
Typically speaking, we are not using disposable masks or face covers. We're using cloth masks, bandanas, those types of things, because that's what our craft like the most. They don't particularly care for the surgical mask or the knockoffs of the N95s or the KN95s. They're more accustomed to cloth face coverings. And typically, most of those are the bandanas that are typically have a cool logo on them or the company name or a safety emblem. And probably 80 to 90% of our craft, that's what they prefer. And that's what we recommend for when we do go back to our offices as well, is we're going to issue cloth face coverings or masks instead of disposable because of that reason. Having, hundreds or thousands of those masks, that does create another potential problem from a disposing of those products. In glove use, we're using just normal gloves, everyday common gloves that we would typically cut to or above type of a glove, where you can actually take those home and wash them as well if you choose to do so. So the disposable gloves, the latex or nitrile gloves, we're not issuing those as a protective measure. We're using the wipe downs and the not sharing of tools, and if you are sharing tools, then wiping them down, things of that nature. But we kind of predicted that we would have a huge problem from a product availability if we went to disposable face coverings. So we bought and purchased and supply the cloth.
All right. I'm going to remind everyone, please pose any questions in the question and answer tab. I've seen a few have jumped in the chat room. It's hard to manage all of those. So if you have a question for the panelists, please ask it under the Q&A tab. I do see one that asked what measures are taken for people that commute together in the same vehicles. I can tell you that we have many company trucks and we have imposed driver only in those. And as far as how men get to, or employees get to the job site, we leave that up to them. But I'm sure there's some companies maybe have urged that to travel in and out on your own. So, but again, please put all of those in the Q&A tab. Last one, and Steve, you can probably answer this. Is the COVID reporting form on iWits or the international website?
The answer is yes. This form is available both on the Ironworkers website as well as the Impact website. Plus, we distribute that every week when Christy Rose issues an update on confirmed cases and all that. So we distribute that once a week. So the answer is yes, it's available on our websites. And if anyone wants to contact us at the numbers that we shared earlier, we'll be glad to send it to you. Thank you.
All right, thank you. And we've got a few, well, here's a question. John, you had mentioned that you guys are using cloth masks. Are those approved by OSHA? Has OSHA taken a stance on that yet? Did you know of?
Since OSHA hasn't taken a stance because they're not considered to be respirators. So the use of cloth masks, you can buy different kinds. There's 2-ply, 3-ply, 4-ply. There's some, people are being very, very creative with these things. But, it's not a problem from an OSHA perspective or compliance perspective, because we aren't using it as a respirator. We're using it as Steve mentioned earlier, and I think Wayne also mentioned, we're using it to control droplet as much as possible, because that's where the exposure is. And what our message to our craftsmen and women with mask usage is, don't do it for yourself. It's not a protective measure for yourself per se. It's protecting your brother. It's protecting the back of your coworker to help if you are sick and you don't know it, because there's so many people that carry this around that are asymptomatic, that walk on our jobs every day, with good intent. And if we can avoid that exposure, it's not perfect, but if we can avoid that exposure through the proper of face coverings, then we can help minimize the impact. And I think there's plenty of science behind that to support the use of face coverings. But it's not regulated by OSHA. If you're going to use respirators, then you would have to follow the respiratory protection standard per se.
All right. As a general contractor, have you been supplying hand washing stations and added more trailers on job sites to get social distancing spread? What are you doing there?
Well, if you're asking me specifically, the answer to that is yes. Those portable units that you can hand pump, there's a foot pedal at the bottom that'll pump water. and have some at a foot pedal that are available through a lot of the provide porta potties as well as trailers of that nature. Those are very common. You know, the use of hand sanitizers I know isn't the best, but at a minimum, having hand sanitizers, hand wipes, those types of things that have been very beneficial to help our folks out as well. But, you know, providing, you know, more facilities per se out on job sites due to COVID, you know, that's definitely one of the first asks that you're going to get from craftsmen and women. And, you know, it's not that huge of a cost issue. So providing more of those is always a good measure to demonstrate that you're caring about folks. And, you know, this is a different time. You know, not everything's the same as it was just a few months ago. So if you're putting more facilities out there, more hand washing, you know, more hand wipes, more hand sanitizers, things of that nature, and you know, you're putting your money where your mouth is.
All right, a couple more here. We have one asking, what are your thoughts or opinions on the use of face shields instead of cloth masks?
Equally as effective. We had a client of ours that mandated that, said that, you know, the masks are fine, but, you know, we wanted to mandate that. There are some downsides to the use of the face shields. If you wear, you know, a lot of you wear face shields all day, but if you're not accustomed to wearing a face shield all day, you know, there's other problems. You know, it can become uncomfortable. It's tight around the head, or when it's dangling from your hard hat, it adds extra weight. And they don't fog as much, but they can. And from a heat perspective, there could be some additional issues there, but they are equally as effective because they're doing the same thing. They're containing the droplet. I don't know if there's a study on which one's better or worse, but, you know, you're using kind of some of your perception there, where maybe a mask or a face covering would contain more because it has less large openings versus a face shield, but they are being used in the industry in many different ways, but you could do both. And I don't think there's a huge issue either way.
All right, another question you can maybe answer for us. What have you guys been doing to control deliveries, truck drivers, outside vendors that are coming onto your sites?
Yep. We have a visitor questionnaire, and it's, you know, when we invite guests to our projects, we send them an email, and we ask them basically 4 questions. Have you been traveling? Are you living or cohabitating with somebody that has COVID-19 or suspected case? You know, are you have these signs or symptoms? And they answer those questions. And then if they answer the questions and they answer the questions correctly, we say, yeah, you're okay to go to this project location. Just show security or site access, you know, this email in return. And when truck drivers and other vendors, or we don't have a lot of salespeople show up to our job sites, which is kind of good. But when other people that have business on our project sites or within our offices, we have a QR code set up, and they just scan the QR code and ask them the questions, and within 30 seconds they get an approval or not approval. You know, we handled probably, I don't know, 8,000 visitor questionnaires at Black and Beach since the inception. We have about 4% that we decline on a daily basis. But that's a good control method to kind of keep people thinking that, hey, you know, you're just not going to run into this job site without being asked some questions. And then if you don't have a mask, we'll give them a mask or a face cover so that they're not bringing it in.
All right, thank you. Question that Steve or Wayne or Jeff maybe could answer. Someone has asked, do you think job stewards should be trained for COVID-19?
I'd like to answer that if I could, please. I think everybody should be trained on it. I think everyone should be trained on how to handle this, what the symptoms are. They need to be trained on the social distancing, what the contractors or the owners' safety requirements are on that particular project. So I think to answer your question, Pete, this particular question is everybody needs training, and maybe the supervisors more specifically, because they are responsible for people working underneath their direction. And that would also include stewards to have this special training and awareness of what the policies are. So I hope that answers that question.
All right.
Steve, if I could jump in there, Steve, you know, this is Wayne. One of the other things with the training is there's a lot of free training available. There are different apps, and there's a lot of other resources that are available where a member could take a training course in anywhere from a half an hour to 45 minutes to an hour and bang through a pretty decent little training program that hits all the basics, so they have a good understanding of what's there. But as Steve mentioned, there might still be site-specific training that may need to go on as far as what those specific criteria would be on a job site.
All right. Quick question. I know you can answer quickly. Where does someone find the link for this COVID-19 response kit you talked about earlier?
We will send that out to all attendees, and it's also on the Ironworkers and Impact websites.
Okay, thank you. Boy, we're getting a lot of questions rolling in here now. One regarding tobacco products, secondhand smoke, and of course, someone who's chewing tobacco, they typically are spitting. Anybody want to tackle that one and put their thoughts in there and what can be done there?
Well, I think unfortunately with that one, that's probably going to come back down to site specifics. You know, smoking, chewing tobacco, sunflower seeds, anything like that, where those droplets could be expectorated out into the open, those should be prohibited. We're trying to prevent the spread of this and this disease, and we need everybody to pitch in to do that. May not be a popular answer, probably one you don't want to hear, but that would be my humble opinion.
Sure. Two questions that are in that both regard, and I know, Steve, you were going to touch on this later, that talk about the use of masks, shields, these kind of things in the heat. So I'm not going to read these questions specifically because, correct me if I'm wrong, but I know you've got some talk coming up here specifically due to heat and the wearing of masks and those kind of things. Is that correct?
That's correct. We received a lot of questions, a lot of calls and emails in the last few weeks or couple months about how heat could contribute wearing all the PPE in 104-degree temperatures, high humidity, and the feedback from the field. So I would like to answer this more specifically as we go to some slides here in just a few minutes.
Yeah, so both of you, the people that have asked those questions, we're going to answer those coming up. Another question here is OSHA requiring a documentation of periodic cleaning and disinfecting of tools and equipment. Anybody know that?
Wayne, what's your
That would be up to an individual company's policy or whatever they have on their COVID response plan. If they wanted to have documentation on that, I'm not aware of any. I haven't seen anything as far as that goes. I have seen sample plans that have, as John had addressed earlier, if somebody had tested or had come down with coronavirus, that there was a form that would be sent out to employees. It would not include any names, but it would be, again, as a best practice to advise those that there may have been somebody that had tested positive on that job site or in that trailer. So that, again, additional precautions should be taken. But as far as a log of disinfecting, I'm not aware of any unless it's in a specific program or policy.
And if I could chime in as well, Pete, I would concur with Wayne's comments there up in Canada. It's just part of the due diligence process. John's earlier comments, you know, the safety management of dealing with COVID-19 includes some formality. So this is something that I believe should be included in their safety management system as part of the documentation record keeping. Thank you.
All right, thank you. And one last question. How do you handle, and this would definitely be an ironworker question, non-believers, members who don't think they should or will wear a face mask?
Oh, Pete, I'd like to answer that if I could, please. Well, we don't have a choice. When you walk on a job site and that owner or that general contractor or the employer has a safety policy or procedure, you have to follow it, okay? Whether it's a fall protection trigger height, whether it's high visibility vests, whether it's 100% eye protection when you're on the job site. So if we disagree with policies and procedures, we can disagree with them, but it comes down to, if you want to comply and stay employed with that employer, we have to do what they say, unless it creates a greater hazard. But that's a whole different case scenario in certain circumstances. But the answer is we have to comply with these policies and procedures that are laid down by the project authorities.
All right, and I would agree with that. Each job site seems to be a little bit different, but it comes down to the owner, their policies, general contractor, their policies, and we have to follow them. So one other one here, quick, and Steve, this may fall to you or Wayne or Jeff. Have the policies been updated regarding sanitizing, disinfecting of PPEs?
Wayne, I don't know anything, but I'll defer that to Wayne and Jeff.
I think John addressed some of that earlier as far as their time in, as far as their limited contact, but I'm not aware of anything. I have some samples that are in that COVID response plan that talk about the sanitizing or disinfecting of the equipment. But John, anything you want to throw in there on what Black and Veatch is doing?
Well, I guess I didn't understand the question per se. I think it asked, has anything changed? Yeah. I don't think much has changed. When you sanitize a piece of PPE, the apply, you have to make sure you're using, the right cleaning agent. And just this morning came out, that there's 2 Lysol products now that have been tested on COVID-19 that kill it. And there was a whole multitude of different products that the CDC has promoted, that do good things, on surfaces and things of that nature. So, using those products, and, if you're not just gonna, have somebody with a paper towel wipe off a piece of a tool or a piece of equipment and say it's good. It has to be a good sound practice, just as it would be before. I don't think anything's changed with that.
No, and we are still challenged with getting our hands on the actual respirators. I know that that's been certainly been a challenge for a lot of our members and contractors around the U.S. and Canada. John, are you guys? How's it been for you on being able to get access to them? And I think maybe that's where maybe we're going with reusing or sanitizing it.
Yeah, it's, when we give out respirators, it's theirs. We don't share. You just create more problems trying to clean them, and you hurt yourself, or if you had a kid or a loved one working on that job, would you want to have somebody hand them a respirator somebody already used? We don't do that. But we've had difficulties with N95s. They're more out on the market now, but we, just 4 or 5 weeks ago, getting N95s just to support construction operations, forget COVID. It was very challenging, but I think that the market has responded. I think we've seen the issues from a supply standpoint, regardless of the item, other than N95s.
All right, that's all the questions we have in there for now. So if you guys want to move on to some other things, that would be a good time for that.
Okay. Thanks, Pete. Before I turn it over to Wayne, there's been some questions regarding the availability of personal protective equipment. Wayne's going to get into the different types of face masks, face coverings versus respirators on the very next slide. But we reached out to our partner through 3M about 3 months ago and put in a large order for some N95 masks, not knowing where this was going to go. We had no idea on how it was going to shift, what the levels of protection were going to be. So we as an organization reached out immediately to put in an order. Unfortunately, 3M and other big distributors are having to give the healthcare industries the first bite of the apple. Okay, so it's going to hospitals, it's going to nursing homes and other caregivers, which it should. So it's my understanding that the construction industry is next. but we're really pleased to have our partnership with 3M. Someone asked for a phone number for a contact of someone they could get information on products. On your screen right here, you'll see Kevin Holden. He's with National Fall Guard. He's a 3M authorized distributor that works with the Iron Workers and Impact to supply our contractors and our training facilities. This is Kevin Holden's phone number and his email address. If anyone would like to reach out to him, he's been very helpful to our organization, and I'm sure you will find that he is too. So when we get these things in, we'll put out a notice and distribute these to our training facilities so Lee Worley can give their people in training situations the proper masks. Next slide, please. I'd like to turn this over to Dwayne Cressup to address this topic.
Yeah, so this has certainly been a challenge for us in the industry is these different protocols here as far as a mask versus a respirator and what is appropriate, especially when social distances cannot be maintained. And so we mentioned before there was different discussion on these, and I think the little cartoon on here kind of indicates some of the things as a safety person that is probably a lot of the other safety people has probably absolutely driven them crazy watching the news. And you see a newscaster and they're talking about masks, but then they show a video of somebody on there wearing an N95, or vice versa, where they're talking about a respirator and then they show a video of somebody with a cloth face covering. And they're using the terms interchangeably. And it's very challenging, especially for our industry, when we've done such a good job on training and educating our members as to what these things are, that we have the media outlets that are not using them and are using these improperly. So I want to take a little bit and explain a little bit about that. So we talked about the distances and the N95 when closer than 6 feet, and John talked about this earlier about a face covering and a face shield. When closer than 6 feet. We've seen that also in a lot of our shop situations, especially if an N95 filtering face piece respirator is not available. So let's go to the next slide and take a look at some of these. So here's the difference. So on the left, we have an N95 filtering face respirator. This is an example of one where it's got a two-strap. It has the lower strap goes down around the base of the neck, and the upper strap goes back around the crown of the head. And you have to pinch the little metal nose piece on there to make sure that you have a proper fit. If somebody has to wear this and it's required for them to wear it, then the contractor is buying into a full-blown on respiratory protection program. And what that means is that they have that they have to make sure that that individual has a medical evaluation, or at least fills out a medical questionnaire that makes sure that they are physically capable of wearing a respirator. Something that is going to cover up their mouth and nose. It is then they also would have to be fit tested for that type of respirator, and then trained on how to use it properly. So there's a lot of things that go into that if somebody is going to wear an N95 or a P100 or any other types of filtering face piece respirators. These go around the mouth and nose. They have a tighter seal around the mouth and nose, and they are actually approved by NIOSH as a respirator. If we move over from the respirator to a surgical mask, we've seen a lot of these out here now, a medical mask or a surgical mask. These are not approved by NIOSH as a respirator, but they do have but they may have, in some cases, may have an FDA clearance for use in a surgical environment. However, that does not mean that they are a respirator. All this does is protect the others that are around them, that if somebody happens to be carrying the virus, it helps prevent them spreading the virus or the droplets. So they have limited protection. They fit loose around the mouth and nose, do not have an NIOSH approval. And all the way over to the far right is a cloth face covering. And as John mentioned before, this is an example of one, same as as John mentioned, the bandana or a neck sock or a gaiter. All those different products that fit over around the mouth and nose, again, are loose fitting around the mouth and nose. They are not NIOSH approved, and they are not a respirator. So again, just like the surgical mask, a cloth face covering does not meet the criteria as personal protective equipment and does not meet the need to be following a respiratory protection program. So just a little bit of the differences there. And again, I also have different slides, or these are hyperlinked on the slides to different CDC guidance. So once you download the PowerPoint, you can actually click on the photo and it'll take you to the different CDC guidance for these, each of these different face coverings. So I hope that helps clarify a little bit of what we see with these, but it certainly has created a lot of confusion because you see them interchangeably. There, I also have video that I will put into the Dropbox folder that shows the demonstration of how valuable these face coverings are when being used and worn properly over the mouth and nose, as far as eliminating or reducing the amount of droplets and vapor that are expelled from the mouth when someone is breathing or coughing, and versus when they have nothing on at all. And that shows, and that's where the CDC guidelines have come in, where they have shown that these have had a significant positive impact when people are wearing them and wearing them properly. Next slide, please.
Hey, Wayne, I have a quick question for you. I may have heard wrong, but did you say that the N95 masks have to be fit tested?
Yes, if they're depending on if they're going to be used, and I should probably clarify that, if they're going to be used in a situation where you're protecting someone from a dust, fume, vapor, or mist that's below the permissible exposure limit, and those N95s are rated for an exposure up to 10 times the permissible exposure limit of a contaminant. However, if they're going to be used voluntarily, in other words, hey, we've checked the air, everything is fine, and we're going to allow it to be used voluntarily, then the employer can share with them what they call Appendix D, which is it basically instructs the employee that they're not to use it in an immediately dangerous to life or health situation. They're not to trade their respirator or their filtering face piece with anyone, and that they make sure that they take care of it, maintain it properly. So that's what is considered for voluntary use. So a couple of different things, and a lot of times the voluntary use gets thrown in there. However, when you're starting to look at requiring someone to wear this on the job site, there are ways that these masks can be fit tested. And there are also some other guidelines, Pete, that have come out on how to fit test a half face filtering face piece such as this. And I will make sure that I get some of those guidelines out there as well, because that's something that the agency, NIOSH and OSHA have come out and offered some different guidance on because of the lack of availability of those respirators in the industry. And a lot of times if you're doing what is called a quantitative fit test for that N95, you actually destroy the respirator as part of that process. And we don't want to go and destroy a whole bunch of respirators just to have somebody to make sure that they're fit tested. So there are some criteria that have been changed for that. I hope that answers the question.
I believe it does. Yep, we can move on.
Okay, so one of the other issues that's kind of come up here is a lot of different respirators, whether it's a full face respirator or a half face elastomeric style respirator that has, or even some of the N95 or P100 filtering face piece respirators that have an exhalation valve on them. There has been some concern that has come out with that exhalation valve. Again, you're filtering in air. It comes in basically as clean air inside of the respirator, and when you exhale, that air comes out, as well as potential droplets that could come out through that exhalation valve, potentially exposing other people to whatever you may have if you happen to be shedding the virus at that time. May not even know that you are, and could be passing that along. So this is a technical bulletin that just came out, was published by 3M. This is their 6th revision here, and it came out here in June. And it reads, while a valve does not change a respirator's ability to help reduce a wearer's exposure to bioaerosols, a person who is exhibiting symptoms of illness should not wear a valved respirator because exhaled particles may leave the respirator via the valve and enter the surrounding environment, potentially exposing other people. So again, just a word of caution with this. And we also included the link to the entire technical bulletin to make that available to everyone that's participating on the call. So again, in some of these different environments, when we have these respirators, they're a great product. However, there may be some concerns with it if someone may happen to be shedding the virus, not knowing it, and potentially exposing others. So again, this is why it's so important for everyone to be wearing those face coverings to help prevent the spread. Next slide. That's wraps up my portion. I will turn this back over to Pete and I believe Steve.
Thanks, Wayne. As we've been returning to work, we're seeing a wide variety of workplace policies, rules, and regulations. And as Pete said at the very beginning, we cannot address all the different states and their particular policies that they've passed in the interim, or everyone's regulations across the country. But some of the things that we are seeing is temperature screening. And I know that John Johnson with Black and Veatch, they test every day people that walk on their site. So this is a very common thing that they're doing, is to try to identify people who have a high temperature, who could be having COVID-19, and keeping them out of the workplace. This is common. Some of our contractors have been asked to do this. And I know the contractors are trying to wrestle with this. We're not in the medical surveillance business. And so this is something that needs to be carefully considered by an employer if they elect to take this responsibility on, okay? Predominantly, we see project owners and general contractors do the temperature tasting for everyone that walks on their project. John mentioned earlier the access questionnaire. You know, have you been out of the country? Do you have any people, family members that are currently have COVID-19? This is very, very important to know. Social distancing. We want to call it physical distancing when in the construction industry, and we'll see some examples of that here in just a minute. But we have to maintain this distancing. You heard John Johnson say that their policy is a minimum of 6 feet. We haven't heard any other numbers. However, that does not prevent a particular employer or owner to have a more restrictive policy. So we have to be aware of that. And also the personal protective equipment that Wayne just addressed. Next slide, please. The question of antibody testing. This is a very technical medical determination. This has come up around the country. Once again, we are not in the medical surveillance business, but this is something that maybe some project owners want to do that work in some very strict facilities. So just be aware of this. It takes on a whole different level of compliance and even costs on their part. So this is something just to watch out for. That's something that's kind of hitting the market right now, is antibody testing, where they want to test your blood to see if in fact they can identify if he or she has the virus or not. Next slide, please. So this comes down to one of the big issues that we want to share with everyone, and we want everyone to give us feedback on. For the last couple of months, we've received a lot of calls, a lot of emails regarding physical social distancing and considerations for the work that we do. Next slide. For example, here's a poll question. Do you agree that common ironworker activities allow for built-in physical distancing? The work we do, bolting, shaking out deck. Please answer yes or no. And Christy, if you could post those results, we would appreciate it. Okay. It's about 50-50. Some agree that we have built-in work physical distance, and some say no. But let's look at some examples, and maybe we should retake this question. So next slide, please. Setting up a typical bridge girder like you see right here. There's no other employees around this connector. And we've been asked the question, if we're doing this type of ironworker activity and no one's around, do we have to wear face coverings? And this person could work by himself at the end of this girder for an hour setting these things. So this is one example of physical distancing that we would really appreciate to get some consideration from our project authorities and general contractors, is do our members have to wear PPE under this particular condition? Next slide. How about common joist erection? Typically, people will set them on the beam side. And as you see here, we have someone in airlift equipment installing the diagonal bolted bridging for stability reasons. So they'll set these joists for several hours and never be within 10, 15 feet of each other. So the question is do we have to wear, should we be mandated to wear face coverings, neck socks, surgical gloves, etc.? Next slide. How about common material handling? We shake out iron from the trucks, we erect columns, we stage iron, and when we have typical physical social distancing like you see right here, should we be required to wear the PPE? Who are we going to infect, or who's going to infect us? Next slide. How about connectors? Making beam to column connections. Typical example right here. If these two members working more than 10 feet apart, would they be required to wear PPE? Next slide. How about bolting beam to column connections? That iron worker could be there for a period of time. If someone else is at the next beam to column connection 25, 30 feet away and no one else is around them, would this activity require mandatory use of PPE? Yes or no? Next slide. Here's another one, rough laying deck. Typically you're at least 20 feet apart. You shake out the sheets, you align them, and you attach them through deck attachments to keep them from moving. The question is should these iron workers be required to wear PPE when no one else is allowed on the erection floor, no one is allowed inside a controlled decking zone? And another issue that's come up is the heat that's produced off the reflection off the decking. And you can see in this particular illustration that when the sun hits this decking, it increases the heat. And our workers have voiced their concerns that, do I have to wear face coverings when I'm rough laying deck? Do I have to wear full face shields and goggles beneath the full face shield? This was a requirement on one particular job site when it was 104 degrees that day, and our members were not trying to be obstinate or non-compliant. They were concerned about their goggles fogging up, as John mentioned earlier, and also the added heat and the anxiety that it causes them to wear face coverings when they think they don't need to wear one. So these are just some common issues. Next slide, please. How about miscellaneous iron on unfinished floors, shooting down shear studs, and applications like this? Next slide. How about reinforcing steel? The work that we do, commonly we can work at safe distances at well beyond 6 feet. So should we be required, given any consideration when no one's around, that we have to wear the PPE? Next slide. That also goes for working on horizontal columns. If someone's threading these bars through here and they're a minimum of 6 feet apart, would they be required to wear PPE? Next slide. How about tying decks like you see here, getting ready for a big pour? These guys are tying these decks. They're maintaining 15, 20 feet apart. So they're wanting to have some consideration for this type of application. Next slide. How about post-tensioning work, routing these cables through the beam side? Our workers need some consideration for this type of work, and that's what we're seeking. Next slide. How about miscellaneous and curtain wall work, ornamental work? You can see here he's wearing a full face shield with a face covering. So the question comes, if no one else is working around him or near him in this piece of aerial lift equipment, would they be required to wear this level of PPE? Next slide. How about crane assembly and disassembly? Our members do a lot of crane and assembly and disassembly around the United States. And when you're up in the air, a couple hundred feet from anyone, doing strenuous work, should we be required or mandated to wear PPE when no one else is around us? When we're putting in, attaching pennant lines, backstays, flies on jibs, things like this, would we be required to wear PPE? Next slide. So here's a poll question. Would you like to participate in a coalition to develop a list, just like we've seen here, to expand this list for common ironworker tasks and activities that illustrates built-in physical distancing to present to project authorities? Not that we're not trying to be non-compliant. What we want is considerations when there's no exposure to expose anyone or to get exposed. Do we need consideration during these activities? So we're asking you. If you have any questions here, we'll take those while you're polling. Please answer the poll question.
Steve, we don't have it in there, but I'll go ahead and ask one I have.
Okay.
Ask if someone would like to participate in a coalition. Is there a coalition that's being developed? Can you speak on that a little bit more? And if people say they want to, how would the process start? How could they get involved?
Okay. Well, it could start with by emailing us and say, yes, I'd like to participate. Send me some more information out to everyone who's on the line today. What it is a collection of activities, collection of concerns where we want to comply with all project authority policies in getting to our workplace. That means when we walk on the job, we go up the elevators, we go up the stairways, we get to our workstation, we're wearing face coverings and whatever they want. However, when we get to our work point, like you saw in the previous slides, could we get some considerations and relief from wearing the PPE when we don't have exposure? So we would like everyone to participate in this so we can develop a laundry list and get to some consensus on how can we best protect our members and yet comply with project policies. That's where we want to go. And we've been asked specifically about this. Do I have to wear one rough laying deck? I'm a connector. Do I have to wear this? No one's around me. So that's why we're asking this, is we want people to participate, give us their ideas, give us some activities that we didn't list today so that we can present this as a platform of compliance and also protecting our members who are working in these built-in physical distancing situations. Are there any questions, Pete?
Yeah, we're actually getting quite a few are pouring in here.
Okay.
Let's see what we've got here. Why would surgical gloves be required under work gloves? And have you seen that or heard of that?
Well, the answer is yes. Unfortunately, I was shocked when I received a phone call that one particular general, and I'm not going to name them, required full face shields, goggles underneath the face shields, face covering or mask, and also some type of surgical leather gloves underneath their work gloves. And this was exactly when it was 104 degrees out in one particular part of the country on a large multi-tiered building. So I was unaware of this, the glove mandate, but it did come up with some large nationwide general contractor. So, you know, we appreciate their efforts to contain or eliminate exposure to COVID-19, but we're also concerned about our work applications and if we're in a position to get exposed or to expose anyone else. Any other questions, Pete?
Yeah, so here's one that's really pertaining to kind of what your point is. Someone's asking, why would we wear a mask or face shield if we aren't within that 6 to 10 feet for an extended time? And that's where a question might be, could workers not wear that neck gaiter and pull it up and down while they get close to someone, they can pull it up? I mean, so we know that many of our job duties, we can separate ourselves, but from time to time we end up, you know, being within that distance some run. So what are your thoughts there?
Well, if at any time that we're within the 6 foot distance, of course we want to wear all the PPE and comply. But when you're on an erection floor, an unfinished floor, no other trades are allowed up there on a multi-tiered building. And we're doing decking, as we saw, bolting, welding, all the activities that we do. And we're way beyond the 6 feet. Should we or must we be required to wear the PPE as if we were in an elevator? And these are questions coming from our members and contractors. So I hope that answered the question.
I believe it did. If you want to move on, I think we got a few others here, but I kind of need to go through them and let's just keep moving forward.
As far as the technical information and the update, you know, as Wayne said earlier, and John, it's an ever-moving target. And so what we talked about 2.5 months ago has changed. There's been some significant changes since 2.5 months ago on what we're learning about this. So please, everybody access these 4 resources. One is the CDC. You can Google that anytime at your computer at work or home, and you can find out exactly what the latest, greatest knowledge is and medical information is on COVID-19. Also with OSHA will take stuff from the CDC and post on their websites. And also don't forget our COVID-19 response kit in a Dropbox file that Wayne mentioned earlier. It's on the Ironworker website. It's on the Impact website. We can distribute that to anyone that responds to us at our email address. And if you could go to the next slide, Pete, I believe, and here it is. Contact us if you would like this link sent to you with this Dropbox file, or go to the Ironworkers or Impact website. Pete, is there any other questions that came up that you think would be pertinent to this discussion?
I think so. One question here, when working on a project and the GC is asking that the temperature monitoring program and questionnaire, is the general contractor then responsible performing those daily checks? And maybe this is one John can help us with, or are they kind of leaving it up to the honor system? John, I don't know if you're still with us and you can maybe answer that. Are you concerned as a GC when you start this program, who's the responsibility falling on, and does that get us into a reportable situation?
Well, I think the critical term here is the general contractor, and typically the GC is the one that sets the administrative structure on a job site. So they set common rules, consistency across the board. I know that on our projects, you know, we set up a process for temperature checks, medical questionnaires for employees of our company, as well as visitors and vendors and contractors. So the system, if you set it up correctly, will work for all of them. And that's really the most responsible thing to do. An honor system can work on a smaller job or even on larger jobs, but you've got to have everybody playing from the same sheet of music, so to speak. And on more complex job sites where access control is established, where you're actually going through a gate or a turnstile or something like that, there's very simple ways to accomplish this task. You know, you can use handheld thermometers for temperature checks. You can do screens that are thermal imaging cameras. That does present challenges with climate control because it can mess up the temperature process. And the questionnaires can be via an app or they can be in person. You know, we set up plexiglass screens like you see at the grocery store, where the questioners as well as the people taking temperatures, they're protected behind that screen, as well as a mask and a gloved hand. And you simply ask those folks those questions. We have one job where we've got 300 craftsmen and women where we have a team of people go to their cars when they drive in and they do the temperature check and they ask them questions. If they are good to go, they get out and they go through access control. So there's many ways to accomplish it. And I think the GC has the primary responsibility to make sure it's done consistently.
Thank you, John.
All right, another one here. Someone's quoting or using information, they say, from a recent international study that says aerosols that contain COVID can actually reach out a distance greater than 6 feet. Has there been anybody aware of any of those kind of studies or what's being done there?
Yeah, I've seen.
Wayne, are you aware of any? I have not heard any. John, have you heard any?
Yeah, there was just on, I don't know which nightly news, but it was on last night where they had a graph. It's kind of a video where they had people sitting in a restaurant at different chairs and different tables, and the ventilation system would move the droplet around. So yeah, there is exposure outside of 6 feet. I would have reason to believe, and I think there's enough study coming out that that's a potential. The good news with construction work is our work is mostly outside, where ventilation is really good, and that does provide us a lot more protection than people in offices, as well as people in the general public if they're eating at a restaurant or going to a gas station or a grocery store. The risk is there. The more ventilation you have to move air, and that's fresh air, the better off you'll be. But I saw the same report last night on one of the nightly news stations.
Thank you, John.
Mm-hmm.
Pete,
Right.
any other questions?
Yes, someone's asked, has the Ironworkers General Safety Plan or Program been updated to add a virus protection program? I think that's in the link you provided, is it not? Or is that something that's ongoing?
No, that's correct. It's updated. We put more things in the Dropbox file probably every week as new things come out, new good safe practices that we can share, things that employers can use, members can reference. It's all in the Dropbox file, and yes, it is updated periodically.
Okay. Another question, and I'm going to add to a little bit. Has ANSI or OSHA determined who's responsible for air quality safety when we're doing inside building renovations, especially an older building that's people are in there, it's tight, there's not a lot of air movement. Who's responsible for that? Probably not just for COVID, but for all risks involved.
I'd have to defer to John Johnson for this question.
I don't know I know ANSI hasn't developed that specifically related to COVID, and I doubt if OSHA has been very specific about that. They may have provided some general guidance. But, from my perspective, the simple answer to that question, it's the employer is responsible to make sure they provide a safe and healthy work environment for their professionals. So, that you're not going to ask on a multi-employer work site have 5 or 10 different companies trying to do, all the same thing, do things differently. That's where consistency is critical. And a lot of that relies on the general contractor to make sure that they're coordinating those types of things. So if you have indoor environments and you need to improve ventilation or increase ventilation technologies, it'd be incumbent on the leader of that project to do so, whether that's the GC or in combination with the client or the owner of that facility, working hand in hand to do that. Because if you don't, and you get people sick, your job's over. And that's the reality of the situation here is your job will be shut down or it'll be scaled back. Then you have a lot of people out of work. So it's everybody's got to pitch in on this, and the people that are ultimately responsible for the job, need to be leading those efforts.
All right. Someone has mentioned here a document that's available. I don't know, John, if you can answer this, but they say that, and this is an acronym, but SMACNA has a good document out that's available for construction projects. Do you even know what that stands for?
Yeah,
I do not.
Yeah, Wayne Crescent does.
I'll jump on that. Yeah, that's SMACNA. That's the Sheet Metal and Air. Let me hear. That's the Sheet Metal and Air Conditioning Contractors National Association, and they have a document on indoor air quality that talks about the proper ventilation, the number of air exchanges that need to be done based on the size of the room and the volume that would be done through that system. So definitely, and I'd be happy to reach out and work with, if somebody wants the information, to work with the SMACNA representative, their safety and health representative. Mike McCoy is an outstanding gentleman, and I'm sure he'd be willing to share that information to help us out. You know, this is something we're all in together. I know a lot of the building trades have been collaborating, but also a lot of the contractor associations have been collaborating on a lot of this as well, in unison with stakeholders in this, to try to help protect all of our members, all the workers in the field, and helping to support the contractors that are performing the work.
The one thing to add on that is Mike, who presented that information from SMACNA, is a very active member of ANSI 10. So thank you, Mike, for sharing.
All right, that's great. One person has said, Wayne, this would be for you, I think, they're having a hard time accessing the Dropbox. Can you explain again where that's at and how they can get at it?
Sure, I'll resend the link to all the attendees, because it's if you're having trouble with it through the Impact or the Ironworkers website, I'll just resend it out to all attendees so they should be able to access it once we wrap the webinar.
All right.
Otherwise, it's a really long name. That's why, you know, with the link. So I'll just resend it.
Sure. I don't know. We have no more questions in the box. We certainly have had a lot of questions, good answers here. I want to thank everybody for their time and joining with us. 3 words I wrote down that John had shared with us that I think are going to be important as we move forward in this. We're hearing a lot of things going on. There's going to be a lot of confusion still ahead of us, change. I'm sure there are times as a society we're going to be ahead of it, and there's times we may be behind. But he mentioned accountability, cooperation, and consistency. I believe those are all going to be very important things for all of us to, some words to really grab onto as we work to keep ironworkers working, keep job sites moving, and until the pharmaceutical and scientific industry can get us so that we can beat this thing. But again, I want to thank you all for your time. And as always, the video will be available on the Impact website. If you want to review or have someone who wasn't able to join us, go ahead and view it. And as you can see, the 800 number or 833 number is up along with the email. So Steve, Wayne, and are available, as is Jeff in Canada, to answer any questions that you may have. So we want to thank you for joining with us today, and we look forward to the next one. Thank you again. Take care.
Thank you, Pete. Thank you very much.